certain lifestyle habits like smoking and drinking and having, high cholesterol can lead to increased levels of erectile dysfunction.
Welcome to another episode of the Matter Over Mind Experience. I'm your host, master trainer, and weight management expert, Narado Zico Powell. And today, I have men's expert and intimacy expert, Dr. Cory, on the show today. So I just gave it away. What we're going to talk about, right? So get ready for this episode. We got some fantastic topics that you definitely want to stick around for. And with that being said, Dr. Cory, welcome to the show.
How you doing, Zico? Nice to be here.
Excellent. Thank you for being here, man. I can't wait for this episode. We have some fantastic stuff. I mean, I'm crazy, so I talk about a lot of crazy things. So we might even get into knocking boots and all kinds of stuff up in this place. So let's get this puppy started. First, let's talk about men's health, right? So the landscape of men's health has essentially changed over the last 40 years or so. So let's start with that. Why do you think that is?
Zico, I actually think it's for a whole bunch of different reasons. I think probably one of the most important reasons is that men are talking. Men are talking way more than they've ever done before. I mean, our dads and our grandpas, they didn't talk about, their junk. They didn't talk about, erectile dysfunction and sex. It was very, very private. And certainly we didn't talk about it in public. It was very hush hush. But today, men are talking about it a lot more. We identify a lot of the problems that happen with age or with certain health disorders. And talking about it is probably one of the most important things we can do to move forward and address some of those issues.
So you say we're talking about it more or we're not talking about it more?
We are talking about it more. We're talking about it on platforms like yours. We're talking about it on YouTube. We're talking about it on social media. We're talking about it in the media. Men are talking about sexual intimacy and men's health in general.
So let me ask you this. What do you find to be some of the reasons why men are having erectile dysfunction issues, right?
I think they actually always had them, but because we're talking about it more, it seems like they're more prevalent. Certainly, men go through the same kinds of hormonal changes that women do as women get older. In their 30s and 40s, women typically don't produce as much estrogen from their ovaries, and they go through menopause. And what do we do to treat menopause? Well, there's lots of different treatments through menopause. Ultimately, if they're bad symptoms, we treat them with hormones. And men go through the same kinds of changes in our bodies as we get into our mid 30s and upwards, and we call it andropause. And andropause means that our balls don't make as much testosterone, and we get symptoms. And a lot of those symptoms have to do with our sex drive, erectile dysfunction, but also just about being tired and not recovering very fast, having low mood, low energy, not sleeping well, even not being able to produce as well in the gym, making muscle, losing fat, things like that. So these things are happening. We're just being able to talk about it and identify it more. And we have great solutions to be able to treat it now.
So when you say great solutions to treat it, can you give us an idea of what you mean?
Well, in terms of low testosterone, there's a range of testosterone. Total testosterone goes in general from some like 10 nanomoles to 30. And that's a range. When you're young, you're like at 30. Okay, you've got the highest amount of testosterone on board, and then it goes down. And there are symptoms that our dads and our grandpas got because they're old and their testicles aren't producing enough. And we know that when we're able to optimize that testosterone up to the high end of the normal range with testosterone replacement therapy, for example, the studies show, and there are many over the last 10, 15 years, that if you can optimize that testosterone with supplementation, there are significant increases in your mood, in your energy, in your sex drive, in your erection strength, in There's longevity studies and your ability to make muscles and keep muscles in the gym and be able to, sustainably lose fat. So being able to get in that little pocket has a lot of win-win-win-win-win benefits. And who wouldn't want to live in those benefits if you were, experiencing that?
So then, when do you think like a male, for example, should think about getting their testosterone levels checked? Should it be a constant thing, like when you go to your primary care, you might maybe once a year, or what are your thoughts around that?
That's a good question. And I think there's two issues around there. I think, yes, when you feel symptomatic, because it's never about a number. It's always about how do you feel. I mean, in that range between 10 to 30, if you started off, not everyone has super high testosterone is at 30. If you started off 18 or 20 and you are at 15 and you go down, you're going to feel a change. So when you feel a change is a good push. Being aware of the symptoms are probably the most important thing. So feeling a change most often happens, we see sort of in the end of the 30s, beginning of the 40s is when men sort of I feel different than I used to when I was 18, 20. The second thing, and probably the more important thing, is that most family doctors and even endocrinologists are not queued up or aligned to know the latest research and data with regards to men's health. And oftentimes it will feel like going to your primary caregiver, your family doctor. If you ask them to test your testosterone, they're going to be like, oh, you're a drug seeker. You're a bodybuilder wannabe. You just want to get a prescription, as opposed to getting it online. And there's this pushback so much from primary caregivers, not that they're uncaring, but they just don't understand because it really hasn't been in their training. Doctors, I mean, I'm a plastic surgeon. I'm a facial plastic surgeon, and I have a big men's health clinic. So I have a special interest. And it's really like that in medicine. There's so many, areas of medicine that doctors really have to have a special interest in to become experts in. And then they do the research and then they get sort of to be the leads in that in the industry. But family care physicians in general do not know about this. And so you kind of have to be your own advocate. You have to go and you got to find clinics that specialize in this. This is the landscape at the moment.
It's interesting you say that, because that exact thing happened to me. It was about 4 or 5 years ago. Now, I didn't feel symptomatic, but I was just curious, and
Yeah.
I went on my annual checkup. I asked my PCP. I said, "Hey, can I get my testosterone checked?" And she was kind of joking around. She's like, "Well, if you're doing well in bed, then you're fine." And I was like, okay, we laughed it off and I kind of went about my business. But it seems more similar to what you're saying, is that they're not familiar with the recent research around it. Now, with you saying symptomatic, right? Because someone may be thinking, well, how do I even know what the symptoms are? I mean, my guess is, until if I'm wrong, or if your energy level is low, if you have erectile dysfunction, that's something to think about. But what are some other symptoms we can think of when it comes to, low testosterone?
Well, a lot of them are crossover. You can have low thyroid and have low energy and be gaining weight. And, you could have low testosterone and have low energy and gaining weight. The sex drive kind of thing is a good clue if you're having ED or low libido and low mood. And it's kind of a collection of all those things. If I had somebody come and say, hey, I have these symptoms, it absolutely could be low testosterone, and I'm going to check them. But I'm also going to check their iron levels and their blood work and their thyroid levels and do a huge array and panel of blood work to make sure that we're not missing anything. And certainly it's in the differential diagnosis. But usually when I see patients, they've already had their blood work done and their general levels for everything done by their family doctors, and they're just frustrated because the family doctors dismiss them and say there's nothing wrong with you. Maybe you need an antidepressant.
Ah, I see. That's an interesting connection that I never actually made as well. And I think you're so right. Even with nutrition and a lot of the things that we're talking about more now, a lot of primary care doctors or general practitioners are not familiar with these things. So you have to go to someone like a nutritionist or a dietitian that's prepared to handle it, or in your case, would be a men's health expert who is willing to handle it or is knowledgeable to handle it. which leads me to my next thought, because someone might be hearing, okay, hormones, 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 this could be dangerous. I could take hormones and, possibly even die, right?
Yeah, for
So
sure.
what would you say to someone to kind of put them at ease with that?
Well, everything we want to do, Zico, is in the land of safe and natural. So in terms of testosterone, again, we know that we have a range, and we have testosterone that doesn't come from the guy at the gym, who knows where it's being made and what quality levels it's being made. This is a prescription that you're going to get from your doctor that leads you to a pharmacy that has pharmaceutical grade safe testosterone, and then we will dose it to a safe level. Now, there's a range of testosterone, and I want you to get up to that high level. All right. And I am a pretty good, guesser as to wherever you are, how much it's going to take to get you there. And then we're going to coach you through how to do that injection twice a week. And then we're going to follow up in 3 months and redo the blood work and see where that is. All right. And so being in the normal range is normal, right? And so being worried, well, what am I putting into my body and all of this? We're just supplementing your levels with a little bit more because you're not making as much as you should. All right. Women take estrogen creams or tablets, and they're not worried about that. And it's the same way. It's just that the oral stuff doesn't tend to absorb as well with testosterone. So an injection is much, much safer. And then we get to measure where that brings it. So this all needs to be done that's, medically supervised in the right, getting your product from the right place, the pharmacy, and making sure that you have repeat blood work. What are the risks of taking too high doses of testosterone? And so we just look at some of those big bodybuilders. They're taking 10 to even 100 times the dose of testosterone, for example, and other stuff that I would prescribe. And when they do it for long periods of time, it increases their red blood cell count and their hemoglobin, and it makes their blood thicker or more coagulable or clotty. And obviously, the worst outcome of a clot would be like a heart attack or a stroke. In addition to that, testosterone speeds up the progression of prostate cancer. It doesn't cause prostate cancer. Otherwise, 50% of the population would have prostate cancer. Okay. Even women make testosterone. So, but what it does is if you have prostate cancer, it can make it go a little bit faster. So we always have to test for, doing a history for prostate issues, and even testing the blood test called a prostate specific antigen, or PSA, which gives a marker of your prostate activity and your prostate health.
So then, because what I'm hearing is that we have safe levels, like you've said that a few times already. And that's why, like, I shouldn't just go to the gym and, find a buddy, be like, hey man, let me just shoot up some testosterone. But, I need to work with a medical professional so I can be within those safe ranges, right? Now, when we're talking about like prostate cancer, heart attack, the things that like you mentioned or people hear about, because I've talked to people at the gym about different things like this, just general conversations. And they will say, yeah, you hear about such and such dying from what they do and stuff like that. My guess is that they're more likely in the unsafe levels, like a lot of the bodybuilders and stuff may do, right? And that's what we usually find. Now, I guess the one thing on prostate cancer, though, I want you to kind of put people's minds at ease with is, do you find that more when people are getting into the unsafe levels, or is could it be just by raising your testosterone level, it can increase your risk of prostate cancer?
No, raising your testosterone level doesn't increase the risk of getting prostate cancer at all. The point was, if you had it, testosterone can feed it and make it go faster. Okay.
Gotcha.
Like cancer is sensitive to testosterone. Testosterone doesn't cause it, but cancer, if you have it, is sensitive to it.
Thank you very much. And I'm glad you clarified that, because I want to make sure I put everyone's minds at ease at that.
Yeah.
Now I want to talk a little bit more about lifestyle again, because which is a big part of the show, is talking about things that we can do in our lives to help us. So what are some of the lifestyle changes that you see men, or choices that men are making now, that may be causing low testosterone?
Again, a good question. So I think there's lots of conjecture about why are testosterone levels low. Some people think it's it's in the water. Some people think maybe it's our diet and there's too many chemicals in our foods and pesticides, or maybe it's increased radiation. I think, these are all ideas that will be very, very hard to prove with tests. But there you have it. I think there is definitely a shift in a correlation to our lifestyles compared to our dads and our grandfathers, where, in their jobs, they were a lot more active. We often lead, unless we are intentional about working out, more sedentary lives comparatively. We do know that we can increase our testosterone levels naturally by working out, by doing, resistance training, by pumping weights. Absolutely. And that can do it to some level, that's for sure. We do also know that certain lifestyle habits like smoking and drinking and having, high cholesterol can lead to increased levels of erectile dysfunction. We know that, in fact, you know, 95% of all erectile dysfunction, and there's lots of reasons to have ED, are vascular, right? And so if we are vasculopaths, if we have, like, high blood pressure, high cholesterol, high levels of that in our body, then in diabetes, the chances of us having a vascular issue with our penis is way, way, way higher. In fact, 2 to 4 times higher. And here's a statistic: we know that 50% of men over 40 have some level of erectile dysfunction. So, diet, health goes along with testosterone levels, but it also goes around with erectile dysfunction. And so if we're not, being, intentional about working out and our diet and our lifestyle, our health span, and with regards to our sexual health span, is going to be crap.
Now, your boy lift weights 6 days a week. So I'm
Oh,
letting
wow.
all ladies know out there that, I don't have any ED problems. So, your boy pumping iron, your boy pumping iron, you know what I mean? But seriously, no. But seriously, I want to talk about the cholesterol piece for a little bit, because
Sure.
when we talk about cholesterol, are you specifically referring to LDL cholesterol, high LDL levels?
Well, I mean, there's total cholesterol, and we have this ratio between HDL and LDL levels, and certainly we like the HDL and LDL in a specific ratio. I would say that both of them probably are important to some extent. And when we look in cholesterol, I'll tell you, the research has really, really changed throughout the decades. What do we want? The good fat, the bad fat, and all of that. But I think in general, we're going to treat you medically if your, ratios are out of whack, and we're going to want to put that down, because we know that when we do, decrease your cholesterol levels, total cholesterol levels, with a statin medication, that there's increased benefit to your longevity. And so, that's probably really, really important. And the fact is that you can often honestly eat really, really well, and, eat no fat, none of the bad fats in your diet, and you can still have high cholesterol. So we know that, the number one cause is probably genetic, probably, familiar hyperlipidemia is something that's hard to control. And yet, probably treating it with a drug might be the best way in the end.
It's interesting you say that, because I was born and raised in Jamaica. We don't traditionally, I didn't grow up eating a lot of fats, but for a long time, I had high cholesterol, and a lot of people in my family. In fact, cardiovascular disease is a lot. I remember I mentioned that someone one day that cardiovascular disease is pretty large in Jamaica, and people are shocked because they're like, oh, in the islands, they don't eat a lot of fried and fast food. But there are a lot of things that contribute. There's a family factor. We have research now that says, excess sugars can be connected to it as well. It's like so many things, a sedentary lifestyle, there's so many things to consider. Maybe not enough fiber could be a part of it. Like, who really knows? That could contribute to high cholesterol, especially when we're talking about our LDL particles. So I think that's something to look into, and I'm glad there are doctors like yourself who like look at the whole picture and don't just say, hey, you know what, you don't have an injury, let me shoot you up a little bit here. Like, that's not what you do. So thank you so much for that. And with that
Yeah.
being said, oh, go ahead, you have something to say.
No, that's awesome. Awesome. I mean, it also relative too, because we go through seasons where, this is good and this is bad, and then this is bad and then this is good, and then it switches all around, and these studies, and we want to be ruled by good evidence. But, sometimes you just got to shake your head and you say, okay, everything in balance, everything in balance.
I've been doing this for so long, Dr. Cory, and I've had these same conversations with people. People who talk about nutrition and lifestyle stuff like good or bad never know what they're talking about. And I would die on that hill. They never know what they're talking about, because this is how I look at anything that with our lifestyles or with our epigenetics all together. I look at three things. I look at ancestral living, I look at scientific studies, and I look at anecdotal evidence, because you can find science that says Honey Nut Cheerios is good for you, right? So you can find science to back up almost anything that you believe. So you have to look at all three. And now we're coming back to we're realizing now our parents or grandparents used to do this, and it's actually good for us because there are things our ancestors figured out that we didn't know. I just came back from Jamaica, and I was talking to people who have no degree, who were schooling me on health and nutrition. And these are like fishermen and farmers, the people who live off the land, because they do things instinctively, versus we just sit here and try to say, oh, what do the studies say? The studies is a piece of it, but you have to know to put it all together. That's why, everybody, you got to watch the Matter Over Mind experience, right?
It's a good point, Tico. Absolutely. It's a good point.
Thank you so much. Now we're at one of my favorite parts of the episode, right? Because I get to talk about one of my favorite companies, the Amino Co. See, their products is 100% science-backed, built on amino acid technology, first funded by NASA, and then further refined through rigorous research and independent clinical trials. So you know what I'm going to talk about? I'm going to talk about Perform, an essential amino acid-based formulation designed to improve muscle performance during exercise, enhance mental clarity. Anything your boy needs, I need a little bit more mental clarity, right? Of course, concentration, reduce fatigue and dehydration, and minimize recovery times. Now, the doc and I were just talking about with strength training, right? So Perform help you to boost the way you train, to perform better in your exercise. It can help you to become stronger and work better. And also with the recovery piece, I mean, it is amazing. And let me tell you how they do this. See, they have a particular blend of essential amino acids. Then there's creatine. And because it has that, they only use about 60 milligrams of caffeine per serving, versus most, I use it more for pre-workout. You don't necessarily have to do it, but for the first 30 minutes or so of my workout, or like an intro workout sometimes. And most of these, like just say pre-workouts, have about 200 and 300 milligrams of caffeine and a whole bunch of sugar. But we know the benefits of essential amino acids for us physically and mentally. We know the benefits of creatine. Creatine has been around before Arnold days. In fact, if there is one supplement that I would say I could not get rid of, is creatine, right? And it's been studied, it's proven, it's been around. I don't find anybody who has a problem with creatine, right? And so with that particular blend, and along with the caffeine, I'm not going to lie, I do double up and go to 120 milligrams of caffeine. But again, it's nothing compared to most of these high sugary pre-workouts, right? And then one of my favorite things about the Amino Co is that they have all natural flavors, which are my favorite, right? So when you go on the website, you'll see where it says all natural, and you can choose those flavors, which are the ones that I prefer and recommend the best, right? But before I even go any further, let me tell you about these fantastic clinical trials. 20% increase in exercise completed, 22% increase in endurance, 11% increase in peak performance during exercise, and 10% improvement in cognitive function during exercise. Don't that just feel amazing? Think about those benefits. I mean, 20% increase in exercise completed, right? And then 22% increase in endurance. I mean, those are large. Even if you're getting 10 or 15%, that's huge in your performance. It can make a huge difference for you. A lot of this stuff, we talk about testosterone, we talk about even steroids and stuff, a big part of it that makes people get their results is the performance piece of it. They can lift more and live for longer. So check out Perform. Anyway, the website is aminoco.com/ZicoHealth. You click on it, you see this handsome face just smiling at you, and you get 30% off. 30% off their fantastic products. Perform, that I love to use, and Heal, that I also use sometimes as a post-workout. The website, I apologize, I lost my thought there. The website is going to be in the description of the episode, so you can click on it and get your 30% discount. And with that being said, I'm going to roll this back to the expert, right? Because we got a couple more things I really want to talk about. So you have a program. It's called The Big Shot, and it differs from most ED treatments, right? So tell us about that.
So the Big Shot's actually not for ED, but I'm going to tell you about it anyway. So men generally in our clinic, we really want to, address three of the things that men really care about the most. They care about having a sex drive, and if you have low testosterone, you got a low sex drive. They care about their erections, and certainly as we were talking about, erectile dysfunction is increasingly prevalent as you get older. Why? Well, because the blood vessels in our penis retract and plug up. They do it peripherally, and the smooth muscle also retracts, and it doesn't constrict to allow the blood to stay in the penis. So you get a softer penis and a shorter erection. The third thing that dudes care about is what our penis actually looks like. Okay. And we know as also we get older, as that blood is going back, our penises get smaller. They get smaller as we get older. And so that's really what the Big Shot is. The Big Shot is male enhancement. It makes bigger, longer, thicker penises when you're soft and when you're hard. And we do it with something called platelet-rich gel matrix. This is a combination of hyaluronic acid, which is natural sugar, with platelet-rich plasma, which is growth factors from your blood. And when you mix them together, you get the magic. You get really a very natural gel that goes underneath the skin and on top of the erectile tissue. And so that means it doesn't change the sensitivity of the penis or the erection ability. And you get a longer, thicker penis when you're soft and a bigger penis when you're hard.
Now, that's a selling point even for me, because I'm saying,
who doesn't want a bigger, longer? Who?
Right,
Who?
I got no problems in that area, ladies. I should let you know, your boy packing. But hey, if you can make it bigger, why not? So
yeah. Well, male enhancement's really the same thing as a breast implant for a dude. When we think about females, lots of women, when they get a breast implant, they feel more confident, they feel more legitimate, whether they have their clothes on or off. And it's really the same as men. And a lot of people think that male enhancement is about sex. It really actually isn't. It is a little bit, but it's mostly about how you feel about yourself. And the gift is legitimacy. It's confidence, saying, hey, you could be naked and feel completely good, whether you by yourself with, in the gym, in the showers, or with a partner. And that's a very, very big, important piece about our lives and how we think about ourselves, because sex, for the most part, starts here.
I work out in tights, so you're about to make my sex life is just about to go through the roof. And thank you so much for that, dear Dr. Cory. But seriously though, so what about safety? Like, are there any concerns about any safety issues?
Well, again, my motto is if it can be done safe and natural, those are the two things. And so, male enhancement's not new. It really, really isn't. Dudes have been trying to use pumps and put, fat on the penis, or they'll even go down to, South America, and they'll get like weird stuff like liquid silicone or implants. And so, they all are wrought with their problems. And that's why we've trademarked Big Shot, because it's the best of everything. It's all natural. That's good. Okay. It's instant. That's good. It's reversible. We can actually inject an enzyme into the product and it will go away within a couple hours. It'll be gone. And the best part about it is that it's long lasting. It lasts a good 3 to 4 years before it's you're going to want to really touch it up. It goes down about 10% per year. So that's why it's the best of everything. It's not something that lasts only 3 months or 6 months. It lasts a good 3 to 4 years. And if you do small little touch-ups at the year mark, it's basically permanent.
I like you. I don't know if you realize that, but when you were talking, you stressed the word long, and I thought that was really interesting. But I like that. I like that.
There you go.
Yeah, man. So, but and that's something to really think about. That's something I'm not familiar with, and I'm sure a lot of guys would, and maybe even some women out there might look into it and be, hey, this is your Valentine's present.
Yeah,
Or maybe be her Valentine's present. Who knows? But a gift that keeps on giving.
there you go.
Um, but with that being said, I pretty much asked everything I was thinking about asking. So we're gonna leave, kind of put it on you now to say, is there anything regarding like men's health that I haven't touched on that you may
Yeah.
have that you want to share?
Yeah. Well, I mean, you had asked about ED treatments. And so, ED is, as I said, is a really important, progressively increasing issue as you get older, and your erections aren't as hard and they don't last as long. There's been a huge drug push for like drugs like Cialis or Viagra as you get older, because they vasodilate, they increase the size of the blood vessels, and of course with that you get more blood in the penis. The problem is you got to take it every time you want to have a sex encounter, and it's a band-aid. It actually doesn't fix anything. And so we know that it gets worse as you get older, and having band-aids is kind of ridiculous. So there's a big new push in a lot of really cool, safe, natural technology that works using acoustic shock waves. And so the new treatment is called Viasure. And this is available throughout the United States and Canada. And it uses this sound energy. Actually, it was originally developed to bust up kidney stones. And then they found that there's a lot of applications in orthopedics and cardiology and urology. They found that when you apply the pulse of sound onto the penis, it actually stimulates new blood vessel growth and new smooth muscle growth. So you're getting both of those issues reversed. Well, that's a fix, and it's natural. And so it takes 6 sessions to do, a week apart. And, it makes it so that many men often do not even want to have to use those drugs again. And to maintain that level, it's 3 sessions once a year. So it's really a cool treatment that's A, natural, B, safe, C, doesn't hurt, and D, allows you to get off the drugs and increases the spontaneity of your relationships, which is pretty cool. So we do a lot of the shockwave Viasure therapy for ED. And that's really changed. That's something that's really changed, where we're not just using medications anymore to be able to help with it.
Like you say, it's a band-aid. It's interesting because I just came back from Jamaica, and as you can tell, your boy's a little bit darker right now. Well, you might not be able to tell, but my viewers can definitely tell I'm darker. And when I was there, I was talking to a lot of people that said that would live off the land, farmers, fishermen, stuff like that, and they would tell me foods that they would eat that they knew would help them to get an erection. Like seriously, they would say to me, "Oh, you drink this, you're gonna be going all night." Like, like lifestyle stuff that we kind of gotten away from. Which lead me to my next question, though. Do you talk along with your treatments? Do you talk to your patients about any lifestyle modifications?
Well, yeah, for sure, diet and exercise and all of that, because it affects the vascularity like we had talked about. But one of the things that we see is that ED is increasingly becoming more prevalent in a younger population. Okay, like guys in their 20s and even in their teens. Well, that's probably not related to vascularity, but what is it related to? Why are rates of ED increasing in the younger dudes? I mean, right? Good question. Is it the diet? Is it the water? Is it that kind of thing? And what's really come out is what's available on our smartphones, which is porn. And pornography, and this is what I do talk of, especially in my younger patients, pornography has a huge impact on males' ability to get hard. It's almost like instant crack cocaine that men get addicted to very young, because it's never been so widely available. And I see a lot of patients in my clinic who say, well, I've got ED. I use everything. I can't even get hard. I mean, I can, but then it's unpredictable and all of this. And one of my first questions in a younger patient is, how much porn are you looking at? Well, I do it every day. Okay. And can you get hard if you're not using porn? Well, that's really hard for me. And that's really the crux of it. Really? So when they have natural, intimate relationships with real people, that crack cocaine stimulation's not there anymore. And they have a hard time to get hard. And that's why it's about here. And so it's probably one of the most damaging things that we can do for our sexual health as men is get addicted to porn. It is no good for anybody. It is no good for the dude, and it is no good for the partner.
That happened to me. That actually happened to me. When I was younger, I had a couple of cases and I called my uncle because I was like, okay, I'm too young. I don't know what's happening, but I was addicted to porn. Like I really was addicted to porn. And it happened a couple times with, the partner I was with, different partners. And I didn't make that connection though, because I did realize that when I laid off porn for like a week, I would feel fine. And I wouldn't have any issues at all. But if I watch porn, let's say the day before, or even sometimes 2 days before, then I tried with her, I wouldn't be able to get hard. And so I'm glad that doctors are talking about that now, because that's a huge lifestyle piece that we're missing. And it's like you said, it's so readily available now, and everybody's pretty much selling their body for $20 or whatever it is. I'm not knocking anybody. That's what you do. But I'm saying is that that's happened to me, and I'm glad that we're actually having that discussion. So thank you so much, because that's a huge lifestyle piece that we're missing. And with that being said, let my audience know, how can they learn about your clinic? How can they learn about your work, get in touch with you, so on and so forth?
Yeah, so you can find me online. You can find me at thebigshot.ca, thebigshot.ca. You can also find me on sovereignmale.com, or you can find me on social media as Dr. Cory Torgerson, Instagram, Facebook, and we also have Sovereign MD, Sovereign Skin. So this is a big umbrella. We got lots of things going on, Sovereign Surgery, but those first three are the best.
Perfect. I'll make sure that at least the bigshot.ca, since you mentioned that first, I'll make sure I put that in the show notes. And of course, the show notes are going to be in the description of the podcast, right? So, and then the show notes are going to be zecohealth.com/thebigshot. That's where I was going with it. That's where I was going with it. So nice and easy. But again, you can click on it, get in touch, access his website, learn more about his work, and get in touch with this doctor. And with that being said, Dr. Cory, this is a fantastic episode. I learned a whole lot of stuff. Whenever I sit back like that and just relax, that means I'm being schooled over here. So I just learned a lot of stuff. Thank you so much. Thank you for listening.
Awesome.
Thank you for watching.
Thank you.
We're out for the day, fam.
Have a good one. Cheers.